Hello everyone. Good morning, good afternoon, and good evening. Welcome to our Institution of Global Professional Free International webinar. Thank you all for joining with us in this wonderful afternoon. My lovely audience, today I am your host. I am Kamrul, coordinator of IGP from Bangladesh. Ladies and gentlemen, I am proud to be associated with IGP as a global member, and I feel honored to host this webinar. And it's my delight to welcome you all to our Institution of Global Professional Free International webinar. Thank you again all for joining with us in this session. And it's my humble request to you that you stay with us till end. And don't forget to take, share, and mention your friend. Before we have completed our 596 webinars successfully, today I will be presenting webinar number 597, and the topic is emotional and psychological health of leaders. Before starting our program, I requested our participants to share this webinar to your friends and newsfeed. Today we have a speaker from Philippines. Today our speaker name is Marcy Adaok Regan. She is a teacher 3 St. Philip High School doctor in philosophy, major in educational leadership. Let's welcome our speaker to the screen. Hello ma'am. Good
Yes,
afternoon.
good afternoon, good evening to all our listeners, our viewers. It's my privilege to be part of the Institute of Global Professional, and I am Mercy Adawag Pagarigan from the Philippines, particularly Department of Education, Tarlac Province, San Manuel District, San Felipe High School.
Thank you ma'am for your description. And now you can start your presentation.
Okay, thank you. As the pandemic, the COVID-19, a disease that prevailed our whole nations, arises way back 2019 at the most very end of the school year, there were big and huge effect on our learners. They were quickly announced to stay at home, or should we say the lockdown, not just only a few days, but it took a year or two. And even now, all movements were bound with restrictions and protocol. Some effects on staying at home where they can get along with their family members, but with long staying at home, their health were slowly suffering, not just mental, but also their emotional and psychosocial well being. The limited information about the pandemic and the news overflowing lead to them the anxiety and fear in the public. And as I say, I was given the privilege to discuss about the emotional and psychosocial health of our learners during the COVID-19 pandemic. The objective of this analyze how human behavior, particularly learners, have changed throughout this period. It only approached the key components of the emotional reaction to the pandemic, how internal and external factors such as personality, traits, the gender, the effect of both media, good and bad, the economy, and the governmental response, the influence, the social perception of the pandemic, and the psychological outcomes of the current scenario. With this, we will only find out how come this factor affect our learners' psychosocial well-being. We will also discuss the several measures that might minimize the emotional impact derived from the scenario and to assist the vulnerable groups, of course, our learner, and promote emotional and psychological support strategies. And what's new in 2021 to 2022 inside the classroom. The abouts, the COVID 19 is having a significant impact on how we interact with others, go about our loved ones, our work, study, and many aspects of our lives. The uncertainty of our situation brings a lot of stress and may have far reaching impact on the people's well being. We can support each other's well being during this crisis, especially this pandemic, which really changed our daily normal life to difficult and stressful situation. We will also give us insight on how to get through this crisis to make us feel safer, less stressed, and less anxious. The Department of Education, particularly here in the Philippines, formulates, implements, and coordinates policies, plans, and programs and projects in the areas of formal and non-formal basic education. It supervises all elementary, secondary education institutions, including the alternative learning system, both public and private, and provides for the establishment and maintenance of a complete, adequate, and integrated system of basic education relevant to the goals of national development. While these agencies have played a very important role for dealing during this crisis as a resilient group to improve the responses in the community. Also, the learners' interaction and actions during this time may be based on the different influence of factors such as hereditary approach, cultural, and individual values and attitudes. The PRC state the Professional Regulation Commission administer, implements, and enforces regulatory laws and policies to the country with respect to the regulation and licensing jurisdiction, which includes the different values of profession. It includes the enhancement and maintenance of professional standards and strategic and the enforcement of such close. It is also deliberately, scientifically, and consistently determine the competence of professionals through the provision of professional standards and judicious issuance of professional license. This such licensing various professions like teachers, nurses, lawyers, and many more. The agencies also includes the Department of Social Welfare and Development. The Department of Social Welfare and Development is the primary government agency mandated to develop, management, and coordinate social protections, poverty reduction solution, and for with the vulnerable and disadvantaged. They also help the society, particularly the poor, vulnerable, and disadvantaged, to improve equality of life and to develop, implement, and coordinate social protection and poverty reduction solution for and with the poor, vulnerable, and disadvantaged. During this time, the DSWD this pandemic also give what we call the amelioration fund. They help these poor and indigenous group how they can be able to survive during the lockdown, which employment had been decreasing, and until now it also came to a problem where some of the family members have been laid off from their job and now continuing sufferings economically. As the COVID-19 occurs and affect the well-being of the indigenous group, particularly the poor and the unfavored, they were also given the chance under the DSWD some support, especially those family who have been part of the COVID-19. Their patient was being sent through a facility and the family were left behind as part of the lockdown 14 days quarantine procedure. Next agency has been very useful and vulnerable also during this pandemic, the Department of Health. This is the principal health agency here in the Philippines, where they are responsible for ensuring access to basic public health services to all Filipino throughout the provision of quality health care and regulation of the health providers. There are three major roles in the health sector. First, the leadership in health. Second, the enabler and the capacity builder. And third, the administrator of specific services. Its mandate is to develop national plan, technical standards, and guidelines. DOH have the biggest role during this pandemic. They provide strategies, maintenance to different health workers, which they can be able to use for the patient, not only the COVID patient, but also includes the different sectors such as patient under medication, like the cancer patient, and the highly contagious diseases. Next, we have the IATF, the COVID-19 Interagency Task Force for the Management of Emerging Infectious Disease Resolution. Under the Article 2, Section 15 of the Constitution, provides that the state shall protect and promote the right to health of the people and still health consciousness among them. The emergence of the severe acute respiratory syndrome or SARS, avian influenza, Ebola, and the Middle East respiratory syndrome coronavirus or the MERS-CoV infection has been acknowledged by the department. In this event, that any of the combination of this disease result in a multi-country outbreaks that can lead to pandemic and even a whole worldwide pandemic that can affect millions of people worldwide.
Dear participants, maybe our speaker facing in network issue. She joined with us in a short time. On the comment box, I see Ekaudikari. She, he is our most active participants in IGP platform. He is from Bangladesh. Ekaudikari, greetings from Bangladesh. Also in Asan Dazang, he is also our active participants. Thank you, Joseph Nabals. Pleasure for mentioning your friends, Mr. Kamal. One of our participants, Hazelmi Gabor, said that we are having difficulty enrolling in this webinar. Actually, we are trying to enrich our website. Our new website is already coming in a short time. After that, you are freely enroll the program and get your certificate. Dear participants, now we are going to our quiz competition session, and after quiz competition we again join with our speaker. Let's welcome our quiz video. Enjoy our quiz video, then we again come back to our speaker. Dear participants, to join our quiz competition, you have to go to slido.com, and today's code is only IGP. The code is IGP. After this session, we join again with our speaker. You can also scan our QR code from the screen. top 10 quiz competition winners get their quiz certificate from our Facebook page. Now 22 participants join with us. Among them, Carmela Bijian, Kiki R. Kulima, Abed de la Cruz, Sonam Yangsin, Jacqueline Bisa, Melinda Sibyl Hispano, Alex Javier Alvarez. Now 24 participants already joined with us. To join this session, you have to go to slido.com and the quiz code is IGP. The link also given in our comment box. Now 29 participants join with us. Among them Malu, Basco, Ginalin, we start our quiz competition after 2 minutes later, so join, hurry up. We will pick your name from this quiz session, so join with your full name, which will directly print on your certificate. And top 10 quiz competition winners get their quiz certificate. Now we start our quiz competition. Be ready. The first question is, what is not a psychological factor for emotional disturbance? Is it childhood, maltreatment, or mental illness? 41% of our participants give the right answer, and the answer is mental illness. On the leaderboard, the first position is Ginelin, and the second one is Evet De La Cruz, and the third one is Sonam Yangsin. Now we proceed to our second question. The question is, what is emotional maturity? Is it putting someone else's need above your own, or the ability to have empathy? 43% of our participants give the right answer, and the answer is putting someone else's need above your own. On the leaderboard, Emily M. Refugio leading the first position, and the second one is Rossi, and the third one is Zignitus. Our next question is thinking like a healthcare professional involves all of the following except learning for understanding or memorizing fact and data. 71% of our participants give the right answer, and the answer is memorizing fact and data. On the leaderboard, the first position is Rosie, and the second one is Emily, and the third one is Lipakunla. Our next question is students with physical health or multiple disabilities have intellectual levels only within the moderate, sharp, and profound ID range or from profound ID to gifted abilities. 47% of our participants give the right answer, and the answer is from profound ID to gifted abilities. On the leaderboard, the first position is Jenny, and the second one is Lipunla, and the third one is Cyrilline. And our next question is a good practice for early childhood learners is specific feedback about behavior and error correction or decrease instructional pacing and collaboration between home and school. 81% of our participants give the right answer, and the answer is specific feedback about behavior and error correction. On the leaderboard now, Lipakunla leading the first position. Congratulations. And the second one is Cyrilline and Jenilyn. Our next question is the following term dash refers to a teacher's mental and physical health. Is it well-being or human capacity? Only 0% give the right answer. On the leaderboard, there is no sense. Our next question is developmental health integrates knowledge from bioscience and developmental psychology. Is it true or false? 97% of our participants give the right answer, and the answer is true. On the leaderboard, Lipakunla leading the first position, and the following Cyrilline and Jenilyn. Our next question is developmental health integrates knowledge from bioscience and developmental psychology. 97% of our participants give the right answer. Our second last question is some essential qualities of healthcare professionals include all of the following except inflexibility or integrity. 92% of our participants give the right answer, and the answer is inflexibility. Our last and final question is Constructivism believes learners are unique with motivation and responsibility for learning. The statement is true or false. 92% of our participants give the right answer, and the answer is true. Congratulations of our top 10 quiz competition winners. Thank you everyone for participating in this session. And top 10 quiz competition winners get their quiz certificate. On the leaderboard, the first position is Cyrillin, and the second one is Lipakunla, and the third one is Sona. Thank you everyone for participating in this session. As our speaker did not connect with us, so we close the program. Today our program webinar name is Emotional and Psychological Health of Learners, and the code is IGP1697. The code is IGP1697. Without code, no one is eligible for certificate. With code, you can claim your certificate anytime. And without an account on our website, you can't do anything. So download your certificate. You have to go to our website. Our website address is cdoigp.com. Then you have to create an account. After that, you have to enroll the program and put this webinar code. Then you can download your certificate. After downloading your certificate, don't forget to celebrate with IGP. Thank you everyone.